The next topic in our discussion of microbiology is in chapter 22 of our Tortora textbook on microbial diseases of the nervous system. There's a nice picture of Naegleria fowleri amoeba in some brain tissue. Bad sign. All right, first we'll take a look at some anatomy of the nervous system before we go on and look at diseases. The central nervous system refers to the brain and spinal cord. The peripheral nervous system refers to all the nerves that branch out or emanate from and attach to the spinal cord and brain stem. There's 3 layers of connective tissue protective coverings around the brain and spinal cord. The outermost, thickest, fibrous connective tissue covering is called the dura mater. Deep to that is a layer called the arachnoid mater, or just arachnoid. Then under that is a layer of or a space full of fluid, cerebrospinal fluid, and then the pia mater. Those are the 3 layers. There's also some, we'll take a look at a diagram of that in a second, but I just want to mention the blood-brain barrier. The central nervous system is a privileged area of your body. It's completely closed off from the rest of your body. The blood vessels that supply your brain, the capillaries, are completely surrounded by foot processes of astrocyte cells or ependymal cells, and the capillary endothelial cells themselves have extra tight junctions. So the passage of materials from the blood into the cerebrospinal fluid and into the brain and spinal cord is very tightly controlled. Many medications that are used routinely in other compartments of the body cannot enter into the brain and spinal cord through the blood-brain barrier. Here's a picture of the nervous system. Brain and spinal cord is central nervous system. You can see all the 31 pairs of spinal nerves emanating from the spinal cord. There's also 12 pairs of cranial nerves that attach to the brain and brainstem. So those are all parts of the peripheral nervous system. So here's a picture of the skull of flat bone due to its construction. And then on the inner surface is the so-called dura mater. It's partly made up of the periosteum of this bone. It's the fibrous covering, and then comes a smaller, a thinner covering of connective tissue called the arachnoid mater. And then there's a space, the subarachnoid space is filled with cerebrospinal fluid, and a very fine connective tissue covering that's right on the surface of the brain and follows every contour of the brain and also surrounds the spinal cord. That's called the pia mater. Incidentally, the dura mater on the outside of the spinal cord is continuous with the epineurium, a connective tissue covering on all the peripheral nerves. So this covering just travels all out to the extremities along all the nerves too. So these 3 layers together, I should have mentioned, are called the meninges. That's the name of these coverings, these protective coverings on your brain and spinal cord. And if the meninges become inflamed, then you have what's called meningitis, and a very familiar, probably sounding term. If an infection penetrates beyond the meninges into the actual brain tissue or nervous tissue, that's called encephalitis. And meningoencephalitis is overall inflammation of both of those regions. A lot of learning objectives. Challenging. All right, let's look at bacterial meningitis first. Bacterial meningitis typically has a pretty fast onset, a fever, strong headache, and a stiff neck. If those things occur in relatively rapid onset, it's very important to seek medical assistance because it's a very rapidly progressing disease if it happens to be meningitis. Nausea and vomiting, followed potentially by convulsions and coma and death. So bacterial meningitis can kill relatively quickly. After we talk about some causes of bacterial meningitis, we'll go on and talk about some agents that cause viral meningitis, which is typically more mild. However, not to make it sound too trivial, because there's a pretty high mortality rate with some encephalitis viruses. So Haemophilus influenza run into this bad player before. Gram-negative aerobic bacteria. They're common in the pharynx of many people, but sometimes it can get into the bloodstream. Usually in young children, babies and young children, and it has a capsule that helps it evade the immune system. So the so-called antigen type B, there's a number of different strains of Haemophilus influenza, but the most common one that causes disease is influenza or Haemophilus influenza type B. That's just the name of the capsule producing type of antigen. There is a Hib vaccine, Haemophilus influenza type B vaccine. It's a conjugate vaccine in which the polysaccharide components of the capsule have been attached to diphtheria toxoid peptide. Makes a very good vaccine for children and babies. So this this pathogen accounts for 45% of bacterial meningitis. Has about a 6% mortality rate. Pretty terrible. How about Neisseria meningitidis? We know that Neisseria are diplococci, so pairs of coccus bacteria. They're gram-negative. Most of the diplococci are gram-positive, or coccus bacteria that cause disease are gram-positive. These guys are gram-negative. 40% of people are carriers. So it's possible for them to get passed around and maybe get into a situation where someone is immunocompromised or whatever reason gets sick from it. Starts out as a throat infection, moves on to produce a rash, bacteremia, bacteria in the blood. Mortality rate is 9 to 12% with antibiotic therapy. Now that's kind of frightening. 80% without. Outbreaks are most common in college students and in military barracks. So it used to be, before they had good vaccines for many types of meningitis, there was a big push to educate college students and their families about meningitis before when they came in as freshmen, in order to lower the mortality rate and the prevalence of the disease. But now there's plenty of good vaccines. I've been polling you students for the last few years, and they say, "Oh no, we never heard anything about meningitis." So I guess they're counting on the vaccine program, which is generally very effective. There's some coccus bacteria and Neisseria bacteria. Streptococcus pneumoniae. Gram-positive diplococcus, so more common probably even. 70% of people are nasopharyngeal carriers, so there's plenty of access to these bugs. It also causes pneumonia and middle ear infections that some children get in infancy and in young childhood. Most common in babies and children again. Mortality rate 8% in children, 22% elderly. So many pathogens that have a high mortality rate. The mortality rate is largely in young children and adults, except for a few exceptions like Neisseria meningitidis, which attacks healthy young people. And there's also a conjugated vaccine in this case too, also with the diphtheria toxoid. So that would be an excellent antigen and makes the immune system really rev up. So how to diagnose? Get a cerebrospinal fluid sample. You need to do a spinal tap, or what's called a lumbar puncture, because the bacteria are in the coverings of the brain, and they're going to be all in the cerebrospinal fluid. So we can get a sample of that fluid and do a gram stain and see what we've got. Then you can do latex agglutination tests for antibodies. Normally, if someone is strongly suspected of having meningitis, they'll initiate broad spectrum cephalosporins immediately, and then begin the testing process, because it's such a fast moving disease. Here's a little diagram showing a cartoon showing someone having a spinal tap, and this is a little inset showing where the fluid is actually taken from, the lower back, as you can see in the picture. That's because the spinal cord ends right about the level of the the first couple of lumbar vertebra, and then there's just nerves, separate nerves hanging down like a bundle of sheaf of nerves. They're separate and individual and able to move around in there a little bit more, so you can reach in with a sharp needle in between the vertebrae and collect a sample of cerebrospinal fluid without the risk of gouging the actual spinal cord proper. Because all these nerves have their own epineurium, connective tissue covering, and again they can move around in that space a little bit. So there's only five lumbar bacteria or lumbar vertebra. Not a 6, not a 7. Just an artist's conception for illustrative purposes, I know. Listeriosis, another bacteria that can occasionally cause meningitis. Listeria monocytogenes, it's a gram-positive rod. It's transmitted in contaminated food. Most people are asymptomatic with exposure to listeria. It's been associated with cold cuts and cheeses, but more recently there have been outbreaks in the United States that has been transmitted by contaminated vegetables that were packaged and processed by people that were infected and contaminating the food, not sufficient hygiene, and contaminating the food. These bacteria can invade the bloodstream and cause sepsis. They can reproduce in phagocytes and even move from phagocyte to phagocyte, evading the immune system because they're trapped within cells the entire time and aren't out exposed to the white blood cells as readily. The big problem with listeria, yes, it causes meningitis rarely, but the big problem with listeria is that it crosses the placenta and can damage or kill the fetus. So it's important if you're pregnant or planning to get pregnant that you are very careful about what you eat and avoid making sure you have very, very well washed vegetables and maybe even avoid cold cuts, eat other sorts of things during that time period. Here's an incredible micrograph showing where a listeria bacterium has traveled from one macrophage right across into another through this sort of inducing phagocytosis in the second bacteria. So this is how one way they can spread. All right, a couple of nervous system pathogens that cause toxin release, very powerful toxins that affect skeletal muscle contraction specifically. So Clostridium tetani, we know all about Clostridium, a gram-positive endospore-forming obligate anaerobe, and so it's found in anaerobic conditions. If you get a puncture wound or some kind of a wound in which there's bad blood circulation or delivery to the area, then these bugs can, and if they happen to get introduced in there, can grow. And while they're growing in there, they don't need to have much of a colony. They'll start secreting this tetanospasmin neurotoxin. When it gets into the central nervous system and the spinal cord, it will start inhibiting neurons or blocking the release of neurotransmitter from neurons that normally are inhibitory to skeletal muscles. So like when you contract a skeletal muscle, if I want to flex my forearm, I contract the biceps muscle, but I automatically reflexively relax by inhibiting the motor neuron to the triceps muscle, so I don't have a conflict. And when you have tetanospasmin, the motor neuron, the inhibitory neurons that control the relaxation of that antagonist muscle are not active, so it contracts as well. So you have pairs of opposing muscles contracting at the same time, and it causes spastic paralysis. Pretty interesting. That's sort of specific kind of a thing. There's a good, very, very good vaccine for tetanus. We don't even really think about tetanus. Maybe you hear just a halo of fear about tetanus and some discussions about it, about being careful about stepping on nails, rusty nails or something like that in the yard. Anyway, that was a time before vaccines and when tetanus bacteria were much more common. They're in the soil, they're all around, but they used to be around much more because they were carried in animal digestive tracts. Cows and horses would feces would result in having a lot of tetanus bacteria all around the environment, and then people didn't have vaccines yet, and it's not uncommon to get tetanus infections and fatal intoxication with tetanospasmin. So the diphtheria tetanus toxoid vaccine, the DT part of DTAP, the AP part, as we said before, is acellular pertussis, Bordetella pertussis bacterial ground up. So we don't have much of a problem with tetanus. Fewer than 10 cases per year. High mortality rate, though. It's kind of unfortunate, right? That's why we have the vaccine. Treatment is with tetanus immune globulin. We're going to give, when we talked about passive immunity, we're going to inject some antibodies against tetanospasmin right into the bloodstream and try to mop up those tetanus toxins and also debride any infected tissue so we don't have a continued delivery of toxin into the body. Here's a woodcut made from a famous painting of a soldier dying of tetanus. You can see the spastic paralysis of the body, again because of pairs of antagonistic muscles contracting vigorously against one another. Botulism, another Clostridium species that produces a terrible toxin. Botulinum toxin, that intoxication typically comes from ingesting the toxin. So if endospores are not completely controlled during food production, canned food could have an endospore in it, which could give rise to a very small colony of these anaerobic bacteria growing in the can and producing botulinum toxin. And then next thing you know, if someone eats it, they're intoxicated with this terrible poison, very, very powerful poison. And in this case, the toxin prevents the release of acetylcholine from the main neurons that control skeletal muscles. So you have, instead of spastic paralysis, you have flaccid paralysis. The body, there's no contraction of skeletal muscles, and eventually, if the diaphragm muscle is affected, you die of suffocation. Heart failure may also precipitate. So it's all about making sure you can complete sterilization of the material when you're canning and using preservatives so that even if there's a little bit of endospore in there, it can't germinate and grow into a colony because there's preservatives that block bacterial proliferation. Here's a very, very famous picture of an entire family who, right somewhere probably in a time in the Northwest when people were pretty much living in pioneer conditions, and they raised as much food as they could all summer and canned as much as they could to be able to eat all through the winter. And in this case, some endospores got into the food, and they all ate their supper and promptly died. So there are several types of botulinum toxin with different degrees of toxicity, but the type A toxin has a 60 to 70% mortality rate. It's heat resistant. When they say it's proteolytic, that just is talking about the mechanism of action. I think we have a slide coming up to show that. Interesting thing, it's diagnosed by inoculating immunized mice with patient samples. So these are the main three types of botulinum toxin. And in the testing lab, there will be 3 different strains of mice immunized with the different types of botulinum toxin, and they will be injected with each different immunized mouse will be injected with some of the patient sample, and the one that survives will be clearly the one who has antibodies against the current type of botulinum, or a Clostridium botulinum, and so that would be the choice for using passive immunization, the anti-serum against botulinum toxin. You can get botulism by eating the toxin. That's the major cause of botulism. But you can also ingest Clostridium botulinum endospores, and they can germinate in the digestive tract, and some toxin can be released, and that can cause disease. Infant botulism, floppy baby syndrome, it's called because of the flaccid paralysis. One thing that's to be watched out for is honey. There can be small amounts of endospores in honey because, again, Clostridium botulinum is around in the soil and all around in the environment. And then if babies eat the honey, then they will not have sufficient commensal bacteria in their digestive tract to outcompete the Clostridium botulinum, and they can get sick from the toxin that's produced by the proliferating bugs. All right. Oh, here's a story. A worker in a daycare center in eastern North Dakota becomes ill with fever, rash, headache, and abdominal pain. Precipitous clinical decline, dies on the first day of hospitalization. The diagnosis is confirmed by gram staining cerebrospinal fluid, and here's your gram stain, and it looks very clear. Usually, you're used to seeing gram stains of tissue samples or such things, and or smears of microbes, and so it looks a little different. This is a little more sparse, but if you look right here, you can see a pair of bugs, pair of bugs, pair of bugs, pair of bugs. And so you can look and see for yourself whether that's gram negative or gram positive, and that should answer the question, right? You have one choice for diplococci for each gram negative or gram positive. It's a little summary table of some things some fungal diseases and protozoan diseases that can cause meningitis and encephalitis. Cryptococcus neoformans. I thought we were going to go into that a little bit. Okay, Cryptococcus neoformans, you may remember, is in contaminated soil. It's a fungus, obviously. It's treated with amphotericin B and flucytosine, and Cryptococcus can cause. It's one of only 3 species of fungus that can cause systemic disease in healthy adults, although it only rarely does. It's also much more common in immunocompromised. Primary amoebic meningoencephalitis. I'm pretty sure there's a slide coming up about this, but just in case, Naegleria fowleri is a bacteria, a protozoan that's associated with still warm water, although it can be in streams, in warm settings, warm climates. And if you swim in the water and you get water up into your nasal cavity, and these amoeba get in there, they will get into the nasal mucosa. They can cross over into the brain from your nasal cavity and begin to eat up your brain, and it's a fairly fast-moving fatal disease. But I think we will encounter that in just a bit. Leprosy, Hansen's disease, Mycobacterium leprae, those mycolic acid-fast bacteria that we've studied a number of times. Look at the generation time of these things. E. coli at 37 degrees Celsius with a rich nutrient environment has a generation time of about 30 minutes. These things are 12 days. It just takes them a really long time to grow, and therefore it takes a really long time to treat them. It grows in peripheral nerves and skin cells. It can survive in macrophages because of its mycolic acid cell wall, and it invades the myelin sheath of neurons. It's transmitted by prolonged contact. You have to have really a significant amount of contact with someone that has this disease, or ingest or inhale some of the secretions, I should say, from a person that's an active carrier. There's 2 different forms, kind of, the disease takes, 2 different sort of courses. Tuberculoid leprosy, there's a loss of sensation in skin areas, especially in extremities. Yes, I forgot to mention, these bacteria grow better at cooler temperatures. So they like to be out at the periphery and in the skin where it's a little cooler than in the core of the body. So yeah. Lepromatous leprosy is a much more progressive and aggressive form in which it forms disfiguring nodules all over the body, causes damage to mucous membranes and then the structures around them. Um, about 100 cases per year, mostly from immigrants from endemic countries. We don't have a lot of disease in this country. It's been pretty carefully eradicated. You can diagnose it with a skin biopsy or a skin smear and see those acid-fast bacteria. Treatment with antibiotics, the big problem with it, like with tuberculosis, is the length of the treatment period, 6 to 24 months of antibiotic treatment in order to successfully eradicate these very, very slow-growing bugs. Here's a picture of leprosy lesions. Here you can see what happens when you lose sensation in your extremities. Constant, repetitive, lifetime injuries and infections in these extremities that aren't paid attention to or aren't really noticed because there's no sensation leads ultimately to the kind of absorption or loss of the digits. What did they ask? Oh, how can we grow bacteria? Originally, the only way to grow Mycobacterium leprae was in armadillos, footpad of armadillos. Nude mice can also grow the bacteria now that we have that laboratory tool. All right, let's move on in our discussion to polio. Polio is a fascinating story. It was a very, very common problem transmitted by ingestion of water containing feces, meaning any public swimming venue, and it was a very common problem in the population. Initial symptoms are sore throat and nausea. Only 1% of cases become paralytic, and the paralysis can be just temporary. So 1% of people have temporary attack of the motor neurons of the skeletal muscles and may need even some help breathing for a period of time until the disease resolves. There are people who would either die of the disease if they weren't intervened with, or people with permanent disability from polio, in which the paralysis became permanent and lifelong. It was a very common disease and a terrible disease. Here you can see a TB ward, so-called. All the people in here, from babies on up through adults, would have to be placed in what's called an iron lung. It was a special machine that could draw air into your lungs by a pump that would suck the air out of this container and cause your chest to expand and pull air in through your oral cavity and then let it out, let you breathe, even though you would have paralysis of your respiratory muscles. So for a couple of weeks, you'd be kind of tied down to one of these so-called iron lungs. Really fascinating part of our history came and went. All gone. The other thing they used to do is they thought that fresh air would be better for people to recover from tuberculosis, and so they formed sanatoriums or sanitariums, institutional housing locations out in the countrysides where large numbers of TB patients could be sent for a few weeks to get over their disease. And some of them still are around, just been repurposed for other uses. You may know of one near where you live. So there's vaccines for polio. The main vaccine is the Salk vaccine. It's an inactivated polio viral vaccine. So it's virus particles treated with formaldehyde to kill them and then injected for the vaccine. There was also the Sabin vaccine, was an actually live attenuated virus vaccine, produces the best immunity by far. But there is a certain risk of reversion, so that a small percentage of cases someone might actually get sick with polio, which is not the intention. And remember, only 1% of people that get polio actually have the complications of polio, but still, this vaccine eventually was phased out. It's no longer licensed in the United States. Still used in areas where there's a lot of polio. Nigeria, for example, they still use the Sabin vaccine. So a Sabin vaccine is better because it's a live agent. It actually infects your body, but has that risk. And the risk was decided to be not uh, greater than the need for that vaccine. So rabies. Here's an interesting topic, a fear-inducing topic. Lyssavirus, a bullet-shaped virus, single-stranded RNA virus. Um, it's transmitted by the saliva of an animal bite typically, and it can cross mucous membranes though. What it usually does is, well, first of all, the vast majority of it's a zoonosis, and it's transmitted by bats in this country for the most part. Other parts of the world, maybe not. This may not be the primary transmission route, but in this country, the reservoir is mainly bats. As far as actual cases in humans, transmission of cases to humans. So initial systems. Well, what's happening with this is that the virus multiplies. First, it gets into the skin. Then it makes its way into the underlying skeletal muscle cells. Then it goes into the motor neurons that control the skeletal muscles, and then travels right to the central nervous system, hitches a ride on the axon transport mechanisms, and gets into the central nervous system and starts killing the tissue, causing encephalitis. Initial symptoms are spasms of the mouth and pharynx, hydrophobia, people have a fear of water. It's thought that the pain of swallowing is so severe that people, just the thought of swallowing when they see water causes them to kind of freak out when they have a case of rabies. The problem there is once you develop symptoms, once it's in the central nervous system, there's no treatment. It's fatal. You have to get treatment right away. There's two kinds of presentation of animals infected with rabies. The furious rabies, where the animals are restless and excitable, versus some seem lethargic and almost in stupor. Anyway, there's just a little diagram of bite from a rabid animal. Virus proliferates, goes from the peripheral nervous system to the central nervous system and causes encephalitis, which is fatal. A hallmark of the damaged tissue in the nervous system is Negri bodies. So these are diagnostic for rabies virus and infection of the nervous system. Treatment. Post-exposure prophylaxis. This is a cool thing, right? It takes a long time for the virus to proliferate, get into the peripheral nervous system, get into the central nervous system. And during that time, you can vaccinate somebody against the virus and stop it before it actually makes it to the central nervous system. So you can diagnose it with a direct fluorescent antibody test, and you can use the vaccine. It's called the diploid cell vaccine, just because there's a cell line that's used in the laboratory to grow the viruses for this vaccine, and it's just called a diploid cell line. Most cell lines are diploid cell lines. I don't know why. That's not the actual name of the cell line. Anyway, also treatment with rabies, immune globulin. We're going to give them that passive immunization with antibodies to help mop up a bunch of the viruses that are free. Get the vaccine to get so the nervous system or the immune system can go ahead and get a leg up on any new viruses that are coming out, and we'll get it under control before it gets into the central nervous system. In the United States, it occurs in bats, skunks, foxes, raccoons, and domestic animals, dogs, and cats, but mostly dogs for some reason. Squirrels, just to put your mind at ease, squirrels, bats, rats, and mice do not carry rabies. They may and very, very rarely get rabies, but they've not been known to transmit to humans. So you don't have to worry about rodents. It's bats, skunks, foxes, and dogs, and raccoons, and bats. So 7,000 to 8,000 cases of rabies in animals in the United States, 1 to 6 human cases. So very, very rare now. People are very aware of rabies, and we try to keep the pool of rabid animals to a minimum. So here's the sort of the distribution map. the range map for different animals that carry rabies that have been reported in this country. Let's see what year that was. Probably pretty recent. Anyway, so you can see these are the animals that most typically carry rabies, but they're not the ones that typically transmit rabies to humans these days. There's just another breakdown of the number of raccoons that have been reported to have rabies, bats, skunks, foxes, put them kind of in order. We've done a very, very good job of immunizing dogs, pet dogs, so we have very few examples of rabid dogs anymore. Here's a map I threw in of reported cases of rabies in bats, because again, that's the biggest, by far the most likely transmission route to humans. If a bat swoops down and kind of nicks you a bit, you probably just got bit. And you can see where in the country they are. Pretty widespread. And there's such a thing as rabies, listeriosis, encephalitis in Australia and Europe. Don't worry too much about that. Congenital infections that cross the placenta, meaning ones that can cross the placenta, can cause serious damage to the fetus. Zika virus, herpes virus, and cytomegalovirus are ones to think about in that context. Zika virus, the main thing to do is to avoid mosquitoes, mosquito bites, and avoid unprotected sex. Those are the two modes of transmission of Zika virus, especially in the southern or quasi-tropical areas. Causes microcephaly. It causes failure of development of the brain among the central nervous system parts. So yeah, that's a terrible, terrible congenital problem. Zika virus, right around the time of the Olympics down in Brazil, there was a lot of panic because Zika virus is an emerging pathogen, and there's a lot of worry about people going down there either to participate in the Olympics or to be tourists. And there are some pictures of our 3 candidate viruses. There we go. There we go. Couldn't get it to go forward. Vertical transmission from mother to child. That's what that's called, vertical transmission. Bacteria that can cross the. Was there anything else I should have said about those other ones? I forgot there was no follow-up. I guess we'll just have to let it go. No follow-up slides on those other 2 viruses that could cause congenital defects. Trypanosomiasis pallidum can cross the placenta. The syphilis agent, Listeria monocytogenes, we mentioned earlier. Group B streptococcus, strep A galactiae, causes all kinds of problems in outbreaks in neonatal clinics occasionally. Elizabeth Kingia, We've never talked about that before, but it turns out to be a common environmental bacteria. And just relatively lately, there's been antibiotic resistant strains and accumulation of those in medical settings. So it's become a true nosocomial issue, even though it was almost unthinkably obscure before this. Toxoplasma gondii, so that's already one we've mentioned before. Toxoplasmosis, you want to avoid getting that. It doesn't cause severe disease in humans, but you don't want to get it while pregnant because it will cross the placenta and then it will cause severe damage. So when women get pregnant in this country, they're tested for a bunch of things that we've already mentioned or treated during birth certain ways, but the torch test, testing for toxoplasmosis, for syphilis, chickenpox, HIV, measles, mumps, and hepatitis B. That's the so-called other component, but those are all things to test for. Rubella, cytomegalovirus, and herpes simplex virus, those other 3 that we mentioned just now, or 2 of the 3 we mentioned just now. We don't test for Zika. Zika is not very common in this country, and especially not anywhere but in the very warmest parts. Arboviral encephalitis. Arboviruses are viruses that are transmitted by bugs, arthropods. And there are several families of encephalitis viruses, and they're quite horrible, mostly transmitted by mosquitoes. Um, Eastern equine encephalitis and Western equine encephalitis have a very high mortality rate, 30% mortality rate in humans. Luckily, they're very rare, relatively speaking, cause brain damage, deafness, and neurological damage. So these are really harsh and death. These are harsh things, but again, they're pretty rare. And so they're not, it's scary, but it's just an unlikely thing. You know, it's like, well, I don't want to use any dark analogies. So you can see how many cases from a 9-year period. In New York State, there were only 5 cases in 9 years. And not every case is fatal, so hopefully there weren't even 5 mortalities associated with that. Still, I mean, I'm not saying it's good, but it's a lot better than some numbers we're about to encounter with some other encephalitis viruses. St. Louis encephalitis is quite mild, and fewer than 1% show symptoms ever even, but it can cause an actual invasive encephalitis. California encephalitis, again, rare, mild, and rarely fatal. West Nile virus has become a real thing that came over in the 1990s to New York City from Egypt, and it's carried by Culex mosquitoes, which is a fancy name for the common mosquitoes around here, and spread to every state in the country, I think, maybe not Alaska, but it's everywhere now. It's maintained in bird cycle. In other words, mosquitoes bite an infected bird, and then they transmit that in the next bite to another bird, and so on until you have large numbers of say, infected crows and blue jays and so forth. And then the mosquitoes are around your yard, they bite you, and then you have potential to get encephalitis. And here's a little illustration of the incidence or prevalence of West Nile virus. It's not really prevalence, it's the actual number of cases in a year in 2016 in different states. So you can see how much more common this is and how it has spread. It started in New York City, and now look down in the south, a lot of mosquitoes down there and a lot of cases of West Nile virus. So it's the most common cause of arboviral disease, encephalitis disease. Most people have no symptoms or mild symptoms. Fever, headache, body aches, joint pain, sort of like flu-like symptoms. But again, most people have no symptoms. And then of those people that have symptoms, 1% can get less than 0.67% approximately can get a kind of a polio-like paralysis. And of these cases that actually show some paralysis, and actual encephalitis, 3 to 15% are fatal. So it's a non-trivial thing, but it's pretty rare that you would get a severe enough disease to prove fatal. But still, avoiding mosquito bites nowadays is a really good idea. Tick bites and mosquito bites are out. Excuse me. Got a tickle. Heartland virus disease and Powassan virus. Powassan virus is up in the Great Lakes region in the Northeast, so it's around here also. I know some of you aren't from around here, but most of us are, just so you know about this virus. Carried by ticks, I believe. Let's see if we got it. Nope. There's a table coming up. So relatively high mortality rate. Japanese encephalitis. So anyway, we don't need to worry too much about that, I don't suppose. How are encephalitis is diagnosed with ELISA tests, firstly. It's a way of detecting IgM antibodies using ELISA. We've talked about enzyme-linked immunosorbent assay, excuse me. The thing about that is the antibodies can cross-react with other viruses in the family. So just because you get an ELISA test that's positive for IgM for a particular encephalitis virus, you still don't know for sure which one it might be. And so then there's usually another test, a second test will be done once there's a positive finding, another more specific test. Plaque reduction neutralization tests. I had not known about this one before, but you grow a lawn of cells on a petri dish with this thin layer of agar on top of it, and then you infect it with um, with virus, a stock of virus, and you have the virus mixed with the patient samples. So if the patient sample has antibodies, it will neutralize the virus and it won't go down onto the plate and infect as much of the plate. Wherever the viruses infect the cells, they'll lyse the cells and you'll have a plaque. And so you can count up the number of plaques in a plate that's just your laboratory virus plus your laboratory cells versus laboratory virus plus patient sample plus cells. That will reduce the number of plaques if there's positive antibody. So that's a way of getting at, and that's more specific. You can use the specific antibodies, and it will, for some reason, do a better job of differentiating. Best way to prevent with all of these types of diseases, controlling mosquitoes, including with malaria, as we've said in the past. 8-year-old girl living in rural Wisconsin has chills, headache, and fever, and reports having been bitten by mosquitoes. What type of encephalitis? Well, it could be this Powassan virus, but we just found out that West Nile virus is the leading cause of domestically acquired arbovirus disease. So the most likely thing is West Nile virus. And there's a picture of a plain Jane Culex mosquito getting a sip. You've seen this a few times in your life, I imagine. And there's a little summary slide of some of these different encephalitis viruses, what kind of mosquitoes carry them, or what kind of arthropod. Ticks carry that heartland encephalitis and the Powassan virus. All the rest of them are mosquito-borne. Who gets infected by them and the mortality rate in this table. So that's a nice little way to review these quickly to see what's up with them. There's the Zika virus. So about 20% of people that get Zika virus show symptoms. They're usually mild, but the virus can cross the placenta and cause microcephaly, as we just mentioned a minute ago, failure of development of the brain in the fetus. Diagnosed by RT-PCR. Best way to prevent it, again, same thing, keep mosquitoes under control. Don't have standing water anywhere around where the mosquito larvae can breed, and swamps, old tires, you name it, planters even in the yard. There's reported cases of Zika virus in the United States for a 2-year period, so more and more common. Probably didn't hear about Zika 10 years ago or 15 years ago, and now it's pretty common that you could get a virus infection. I'm not sure what this means. It says locally acquired is this darker colored in Florida and Texas. I wonder if this means that all the rest of these cases, I imagine it means, were people that traveled outside of the United States to visit, Central America, South America, and like that, and came back and showed positive. So it's not like you're going to walk outside and get Zika virus from a mosquito in upstate New York. Cryptococcus neoformans is associated with moldy chicken and pigeon droppings in the city or on farms, and transmitted by a respiratory route. It's an opportunistic infection. Again, it rarely causes disease, except in the immunocompromised. It can, but very rarely cause disease in a healthy adult. Treatment with amphotericin B, as we mentioned just a little bit ago. And there's a picture of Cryptococcus with its thick capsule, which lets it do the things that it does. All right. Protozoa. That causes damage to the nervous system. Trypanosomes. Trypanosoma brucei gambiense. African sleeping sickness or African trypanosomiasis. I can see that of late African sleeping sickness is no longer an accepted term. You can either call it African trypanosomiasis or you can call it sleeping sickness, but apparently not African sleeping sickness anymore. I don't know why. I'm just noticing in the text. So there's this particular gambiense is just as a human reservoir only, transmission from human to human by way of tsetse flies. That's the tsetse fly is the vector. this Rhodesians species or subspecies has a reservoir in cows and horses and so forth. Few early symptoms, followed by fever, headache, and then very quick deterioration of the CNS. And once that happens, it's a fatal disease. So the main thing to do is to test and treat aggressively so that it doesn't get to that point. And we talked about this agent is the one that it has antigenic variation. So here's weeks after infection and the relative number of trypanosomes that are circulating, and it rises to a peak, and then it starts to go down. The immune system starts to produce antibodies, and antigenic variation and a whole new look to the pathogen, and it's able to grow uninhibited for a while, and so forth and so on. So that's probably how it can cause disease. How it can evade the immune system is by that changing over of the antigens that are on its surface. Prevention, controlling the tsetse flies, and also testing all the livestock to make sure there's not infected animals forming a reservoir in the area. Naegleria fowleri. This causes primary amoebic meningoencephalitis. So again, if you're swimming in warm water, and especially if you don't know the area, but you should probably think twice, because if you get these amoeba onto your nasal epithelium, it's a very dire situation. There's no treatment, and there wouldn't be time anyway, probably. Very fast progression of the disease. Acanthamoeba, another type of amoeba that we talked about before when we talked about skin and eyes. If you have contaminated contact lens solution, you can get keratitis, infection in your corneas. But it almost never, or as far as I know, never, from what I've read, goes from that to become a fatal encephalitis or a severe encephalitis. That's transmitted a different way. So granulomas, growing like clumps of tissue forming around with lots and lots of white blood cells forming around the site of infection, forming lesions around the brain, and opportunistic infection for the most part, causing encephalitis, fatal encephalitis. Balamuthia mandrillaris, another type of free-living amoeba that causes encephalitis in animals. We won't worry about that one. There's a picture of Naegleria fowleri has a flagellated part of its life cycle and a cyst part of its life cycle, and there's the free living or free swimming amoeba. Prions. Prions are that most mystical thing of all pathogens, in which is just a simple protein that somehow can infect the body, and it's a misfolded version of a normal protein in the body, which when it comes in contact with that normal protein causes it to misfold, and so on and so forth. And you wind up with precipitates forming in the brain and in nerve cells, endocytosing those misfolded proteins from their surface and killing the nerve cells. So spongiform degeneration caused by prions. Transmissible spongiform encephalopathies, they're called. There's a disease called scrapie in sheep. That's the same exact thing. It's a prion disease, but it's not transmitted to humans. But in cows, it is. Bovine spongiform encephalopathy. If a human consumes some of the nervous tissue from an infected cow, then they can years later, it takes years for this to progress, years later develop Creutzfeldt-Jakob disease. Transmissible spongiform encephalitis in humans called Creutzfeldt-Jakob disease. It can be sporadic and familial, but the transmissible one is from bovine spongiform encephalitis. Chronic wasting disease occurs in deer and elk, but it's not transmissible to humans. And Kuru was a transmissible spongiform encephalopathy that was transmitted by cannibalism. There's cannibalistic cultures or tribes of people that that's how they would, when they got into competition with their neighboring tribes, they would catch and eat some of them, and they got this disease from that. That's cannibalism's been pretty much eradicated. So has Kuru from the world. And there's a picture of some just gaps in the central nervous system where the neurons have been killed by the prions misfolding on their surface. There is such a thing as a inherited Creutzfeldt-Jakob disease. There are some families that have a very high frequency of Creutzfeldt-Jakob disease. Prions are very tough to destroy. They're just proteins, and you can't just sterilize them under the normal conditions. They'll just still be there and still misfolded just like they were before, and they'll still cause disease. You have to use strong sodium hydroxide and very, very high temperature. I don't know if you remember, but the standard conditions for sterilization with moist sterilization is 15 pounds of steam for 15 minutes at 120 degrees Celsius or 122 degrees Celsius. Here you can see we've had to bump it up to 134 degrees to make sure to damage those proteins, hydrolyze the bonds of the amino acids in those proteins so that they're just not even together. There's no way to detect it. Only way you can detect it is by the symptoms of the animals. So when there's a livestock, branch, they'll recognize the signs of the animals that have disease and get rid of them, and oftentimes get rid of large numbers. If there's an infestation or an outbreak, I should say, in a population of beef, cattle, they'll be killed, burned, or buried. That's just a little diagram. We've already seen this diagram of misfolded prion protein coming in contact with the normal PRPC on the surface of a cell, causing it to be misfolded, more to be misfolded. They get endocytosed into the cell, and they can't be processed by the cell. They're all out of whack, and the cell winds up with a lot of storage of these things, and it dies. Disease caused by unidentified agents, acute flaccid myelitis. Muscle weakness, limb weakness, drooping eyelids, difficulty with swallowing or slurred speech. That might be Lou Gehrig's disease. Amyotrophic lateral sclerosis. There's a degenerative disease. It's not an infectious disease. It could be confused with that easily enough. But apparently that's been ruled out in some cases, and they still have this disease of muscle weakness. Bell's palsy is an anomaly that occurs sometimes after a viral infection, where someone has for 3 days or so just complete paralysis of some part of the facial nerve that controls all the muscles of your face and your eyelids and so forth, and it winds up just drooping, kind of hanging there with saliva drooling out of the side of your mouth because you can't control the muscles of your face for a few days, and then it tends to resolve on its own. Here's a bad thing. Myalgic encephalomyelitis, which is the sort of more proper name now for chronic fatigue syndrome. Chronic fatigue syndrome is a bad problem in which someone who probably becomes infected with a virus of some kind and then has a lasting change in their nervous system becomes very, very severely fatigued and has flu-like symptoms that don't resolve. There's no known ongoing infection in their body, but they have flu-like symptoms and complete loss of energy, and it lasts for years. It lasts for the rest of their lives for the most part. For most people, the flu-like symptoms of it sort of dissipate in middle age, but the tiredness still remains pretty much of a chronic problem. And then it sort of morphs into other kinds of problems with the nervous system and the muscular system with age. So it's a terrible, terrible lifelong disease that nobody really understands very well, but at least it's gaining some credibility among researchers and healthcare providers. Even to this day, a lot of healthcare providers don't really believe in it, and they don't take people seriously when they come in with the disease. And it's very, very trying when you're a person who has a severe disease like this, and you're coming to look for help, and they just look at you and say you're full of it, or you have a psychological problem. Go away. And it's very fascinating, because we don't have a good etiology. Then some people just don't even believe it. They can look right at it and not believe it. It's insane. After eating canned chili, 2 children experienced cranial nerve paralysis, meaning the nerves of the head and neck, followed by descending paralysis. The children are on mechanical ventilation. Leftover canned chili is tested. What do you think it is? I think you can guess. Botulism, right? The botulinum toxin was in the canned chili, and they started getting paralyzed, flaccid paralysis from that toxin. So there's those bad acid-fast bacilli. And here's a summary table of some of these organisms that we've been just going over that cause issues with the nervous system. All right, I didn't say anything with this slide. This is just theoretical. You can take a look at that. Maybe even Google it if you want to and see what's going on with that research. All right, join me next time as we move on to our next organ system. I believe it's the respiratory system. Is that right? Yeah, so we'll take a look at that next.